Government, one of the things that we're most proud of is the launch of Kenya Mental Health Action Plan. And I must say, I must thank Senator here because she's part of the team that made this possible. His Excellency the President, 2 years ago, was able to identify that there is a gap when it comes to mental health in Kenya. And what he did was quite novel, as opposed to previous task forces where you have the technical experts sitting in there. This time around, the task force that was formed had a community view. It had community members. Of course, we had Dr. Frank Jenga and other experts there. But essentially, the idea was to move beyond the hospital and ask ourselves hard questions on, are we doing enough in investing in mental health? And so this task force came up with a report, and this report was then sort of integrated into what we call the Kenya Mental Health Action Plan. And we've launched that action plan, and it is now under implementation. So what is good in the action plan? One, the realization, and I agree with you, that over the years, sadly, we've not invested heavily in mental health, but now we are. As opposed to having a centralized system where we had just one referral hospital, Mathari, the Mental Health Action Plan actually envisions regional mental health hospitals. But more importantly, it actually devolves mental health services. For the first time, there's an expectation and intention to ensure that mental health services are available at the primary healthcare level in the country. And that is a game changer. And what that means is then you're going to need psychiatric nurses, you're going to need psychiatric clinical officers there, you're going to need those medicines available in the health centers and dispensaries. And remember, why it's so powerful is that most Kenyans actually access care at that level, at the health center and dispensary level, before they go to the advanced levels of care. So that's therein is contained in the Mental Health Action Plan. The second thing is what you've raised, community awareness. We've often dealt with mental health from the technical, physician level. Now there's a realization and an admission that we need to have community champions for mental health. We need to have the involvement of the church. We need to have the involvement of village elders, people who are trusted stewards within communities, who are trained by the different divisions and structures, both at national and county departments of health, to ensure that these guys are champions. They're able to demystify some of the issues that you've raised, and you're completely correct. Your research is spot on. Those are the issues that we keep encountering. Myths on witchcraft, myths on gender, relations. And so we are putting together what we're going to call mental health community champions. The third thing that the action plan addresses is the cost of mental health services and how we need to put in place a financing mechanism that is able to bear those costs. I'm sure you've heard of some of the prescriptions that mental health patients use are very, very expensive. These are chronic medicines. Some go for as far as 100,000. And those are not even available sometimes in the public sector, in fact, most times, I dare say. And so there is a plan to see how do we include mental health conditions as part of the reimbursement package of NHIF. And then how do we even have agreements and plans with certain pharmaceutical companies to ensure that the cost of these medicines are reduced. And I think for me then the most impactful will be within the next few years, and the President pronounced himself on this, is that Mathari Hospital will move from Nairobi, where it is, all the way to Karen, where you can, have restful healing, rehabilitative services, and even for the first time, drop the name of Mathari Mental Health Hospital and call it a well-being center. I'm not sure if it will be Karen Well-being Center, but we will find a name for it. But ideally, there's such a focus right now on mental health, good political focus on it and commitment on changing the space. And then also to add, COVID-19 brought in a silver lining. For the first time, the ministry now recognized the role of a psychologist. Before, we didn't have psychologists in our schemes of service. Now we do have psychologists. And so it's small steps, but definitely more needs to be done in that area, and we are working towards that. Okay. Wahiga, I had a second question. Should I jump into it, or do you want to? Briefly, if you can. I'm not known to be brief, but right. In terms of retention in health facilities is illegal. And I think for those private health providers and public health providers who are watching our show today, just to emphasize and to repeat, it is illegal to detain a patient because of unpaid bills. Now, most of the questions we get from the providers are, yes, we agree, we should not retain a patient, but what do? We've incurred costs in providing care for this patient. And one of the things that we are doing as government, particularly right now, is really focusing on NHIF, and particularly after the support we've received from both committees, National Assembly and Senate, very soon it will be mandatory for all of us to have an NHIF card. Once that happens, those who cannot afford NHIF will be able to get government subsidies, which then means, therefore, Kenyans will have the ability to pay for care and providers will get their reimbursements. But until then, it still remains illegal. And I think just last week we were dealing with a case of a hospital, and the medical council, which has a mandate, can actually withdraw your license for detaining patients. And we've actually started doing that.
And I was going to ask, it's illegal, yes, but until we see consequences, they might still continue
We've actually started doing that.
You've started doing that. Dr.